Okay, is everybody ready?
We're ready. Yes.
Yeah? All right, so a couple of housekeeping things. Remember, we have food and snacks over there. Please don't bring them in here. If you can eat them out there, just to make sure we don't have any mess in here, any bugs or anything like that. If you have a cell phone, please silence it. We don't want to disrupt, throw anybody off, so please make sure to silence your phone while we're doing the presentations, just so we can get through them. Other than that, this session is going to be Community and Veteran Services, and there's a lot of good services on here. I'm a little biased because this is our department. But we're going to have a welcome from Commissioner Amanda Ballard.
Thank you so much for having me back again today. So today we're going to talk about Community and Veteran Services, and I am also a little biased. This is one of my absolute favorite departments in the county, and they do really amazing work. And it's the kind of work that a lot of times gets overlooked in favor of things that involve development or infrastructure, but these services are truly so essential to people in our community. Those people who maybe people don't always think about, like underserved children. So Community and Veteran Services, it includes our Neighborhood Services Division, which really gets in there into every neighborhood, gets to know them on a really deep and granular level, and they just do amazing work. We have Children's Services, which has the Children's Services Advisory Board, and they're able to work with nonprofits to provide about $16 million worth of grant funding to nonprofits throughout our community that are serving those really those children who are underserved, who could end up in foster care, for example, providing them those services so that they can be strong, healthy, and productive members of Manatee County in the future. We also have in this department our probation services, so county probation, which we just have some real all-stars in that department who really take that mission of taking people in the probation system and helping them to turn their lives around. They take it to heart, and it's not just kind of shoving someone through the system. It's about helping them to change their life again so that they can become a productive member of Manatee County. And so I just can't say enough wonderful things about the staff of this department, the mission of this department. One of the reasons that I'm particularly working so closely with members of this department is that we have set out on a mission to really address homelessness in Manatee County, and we now have a homelessness services manager in this department, and we are working very, very hard to increase our shelter capacity, hopefully keep many kids out of foster care, help to get people off the streets, improve the quality of life for people all around the county, and help those people to turn their lives around and, again, become productive members of Manatee County. So with that, I will turn this over to Sarah Brown.
Nobody should ever give me a microphone. It's a bad idea. But anyways, good morning. My name's Sarah Brown. I am the Director of Community and Veteran Services, and I couldn't be more proud to be the director of this department. About 140 staff, 11 sections and divisions, and we are dedicated to helping people, from children to seniors to veterans to animals. Animal welfare joined this division back at the end of 2023. I'm also very passionate about that because I was the chief of that division for 9 years, and still feel like I'm still the chief of that because it just kind of follows you around forever. But we do great things in this department, and we help people on a daily basis through our programs trying to make this community better. And I just love the work we do. I'm so passionate about it, and I can't wait for you to all hear about it today. So I think that's about it, other than enjoy, have fun, silence your cell phones. It's super important because you're going to hear such great information today. Thank you so much.
Thank you, guys. We're going to do similar to how the last couple of sessions where you write your questions on the Post-it note, and then we'll collect them from you, and then at the end, we'll do all that so we can get through the presentations, and then they'll stay to answer any of those questions. So be aware of that, too. If you haven't got Post-it notes, I'll come around and I'll give it to you. So up first, we're going to have, this is an overview, really, of all of our departments, but we are going to have community development. So here's Debbie, Ash, and Julia, and they're going to tell you about that. And here is your clicker.
Thank you. Good morning. My name is Debbie Ash, and I am the Housing and Community Development Coordinator for the Community and Veteran Services Department. I have been at Manatee County for 19 years, and I have worked in the same division for the entire time. So I have seen firsthand what incredible programs we have, how we serve the public, and the families we assist. I'm also biased because we do incredible work in community and veteran services, but our housing programs are really incredible. So I've always worked with housing, and so I am going to talk about our housing programs this morning. So thank you for coming out on this rainy day. It would be hard to get out of bed, but we appreciate you coming. So let's get started. So within Community Development Division, we receive state funding, which is our SHIP Housing Initiative Partnership Funding, which we refer to as SHIP. We receive federal funding, which is our Community Development Block Grant funding, which is CDBG, and our Home Partnership funding, which is called HOME. And so with these funding sources, we administer a range of public service, housing, and construction programs. So I'm going to go over the housing programs that we administer, and then I'm going to turn it over to my colleague Julia, and she's going to go over the other services we administer. So with our housing programs, we currently administer down payment assistance, homeowner rehab, and homeowner replacement, and then we've recently acquired the affordable housing program, which allows developers incentives to develop affordable housing in Manatee County. So down payment assistance. So the American dream of home ownership. You know, first-time home buyers may be able to qualify for a first mortgage, but they can't come up with that down payment. They require about 20% anymore for down payment, so that's a huge chunk of money. So that's where we can come in to help. So first-time eligible home buyers, which are very low, moderate income, bless you, buyers that qualify can purchase an existing or newly constructed home, and Manatee County can assist with up to $70,000 for down payment assistance. So this takes some of the burden off the monthly payment. It can help reduce their interest rate because they have a better ratio. You know, our foreclosure rate with our down payment program is very, very low, so it keeps people in their home. It keeps the community. You know, it's just a really great program. This is one of my favorite programs, and you know, we get a lot of recognition for it. So, our other program is our rehabilitation program. So we can use these funds to assist homesteaded homeowners in unincorporated Manatee County in the city of Palmetto. We love the city of Bradenton, but we do not provide our services there because they receive their own funds. So we do provide all three of these services in unincorporated Manatee County and the city of Bradenton. So, in the city of Palmetto, I apologize. So with this program, we address health, safety, code-related issues, and then we do hurricane mitigation. So people that qualify, we can address any electrical, plumbing, we can replace their roofs, we do all the additional strapping and nailing, we do impact-resistant windows, impact-resistant doors, we do tree trimming, and we do all of this, and the maximum assistance level is $95,000, which seems like a lot, but when a roof costs $20,000, windows cost $15,000, it adds up very quickly. So it is an amazing program. It allows people to age in place. It keeps the neighborhood, the houses from falling into disrepair. You know, people are staying in their homes. Perhaps they can leave it to their children, providing generational wealth. So this is a great program. And if the repairs would exceed that maximum amount, we have a replacement program. So we can demolish somebody's home and replace it, which, of course, at that point, we would, comply with all of the current codes. Everything would be up to the current standards. All of the hurricane, mitigation would be at that house, which would allow people to, again, age in place, stay in their homes. It keeps the community, free of blighted properties, and they're paying into the tax basin, so it's all good for Manatee County. So this is actually my favorite program, not the down payment program. It is. Some of the houses we go into, you wouldn't think people would be living in those conditions, and they just don't have a way to get out. It's very expensive to keep up with those repairs, and this also serves just low and very low income households. So it's hard to keep up with those repairs if you're living on disability, if you're living on Social Security. So all of our funding is in the term of a 0% deferred loan. So as long as you stay in your property as your homesteaded property, and there's no interest and no payments. So if you were to sell the property, transfer title, buy another property and rent this property, you would owe Manatee County the money. So we do monitor these properties annually. We have a compliance team that looks at the properties to ensure they're still homesteaded, their taxes are current, and they haven't changed ownership. If they were to, they would owe Manatee County back the funding, and we would put that back into the pot to assist additional families. And then after 20 years, we will just satisfy the mortgage. So we'll be out of your hair. So the newest program that we have is the Affordable Housing Designation. So this program used to be housed in Development Services, and we've recently acquired it into our department. So the goal of this program is to work with developers to provide incentives to them to develop affordable rentals, affordable home ownership, and mixed use. So where there would be a mix of low income, moderate income, market rate rentals. So they have to get that affordable designation, they have to set aside 25% of the units for affordable. So if they are doing a 100-unit rental, 25% would have to go to low, very low, or moderate income households. They are required to sign a LURA with the county, which right now it's 30 years. So we will monitor them for 30 years to ensure that they are in compliance with this program. And some of the program incentives are for the developers, which all of these equate to dollars. So it allows them to have a reduced sales price or reduced rental. So housing rapid response or fast tracking, fee deferral and reimbursements. They have access to the Tree Protection Trust Fund, which can help pay for the required tree buffers that they may have, or if they remove trees, if they have to replant trees. Density bonuses, and this is a CLOS, which is a certificate level of service, and this is something that's required for developers to provide that basically says that their project's not going to impact the infrastructure. And then site improvement incentives, which are parking ratios or some other incentives. So at this time, I'll turn it over to Julia to go over our other incentives, not housing.
Thank you, Debbie. Good morning, everyone. My name is Julia Vieira. I'm the Community Development Project Manager for Manatee County. I work very closely with Debbie in community development, but my focus is mainly on partnering with nonprofits and to provide services or improvements in our infrastructure to serve our lower income population. So we are mainly funded through the grants that Manatee County receives as an entitlement community to the U.S. Department of Housing and Urban Development. And so because we are an entitlement community, we received annual grants for different initiatives. Some are just general community development, so that targets services and construction to low-income neighborhoods or to serve low-income residents directly. Other grants target initiatives for providing services to the unhoused population, and other that we match with the SHIP funding that Debbie just went over to provide direct services and construction incentives for homeowners in terms of housing affordability and allowing residents to age in place. So I will start with the services. Through those different grants, we partner with several local nonprofits that do amazing work in Manatee County. And currently, as a result of the housing affordability crisis, and after the COVID pandemic, with all the stress in the rental market especially, we have been focusing a lot of our grants in rental assistance to allow people to stay housed and prevent homelessness. Especially, we focus on families with small children or elderly and senior residents. So we have, across all the different grants, we have, the Board of County Commissioners have allocated over $1 million in rental assistance currently. And now it's the only funding that's available, as all the COVID incentives through the federal government have gone away. So it's really now up to us to provide for our residents. And the Board of County Commissioners have been very supportive of those initiatives. Other services that we provide in partnership with nonprofits are dental assistance and legal assistance. Dental assistance is one that I'm very proud of. It's a partnership with Turning Points, and we have been awarded twice, once at the national level and most recently at our regional level from the Tampa Bay Region Planning Council. And this is an amazing program in which through the Community Development Block Grant Funds, we assist Turning Points and their dental services, and they're able to provide dental and prosthetics at no cost to low-income residents. And so we have, over a decade in partnership, provided those services, especially the prosthetics, to over 3,000 residents in Manatee County, to, allowing them an increase in quality of life and oral health. Legal assistance, that's really focused on housing legal matters, and so for residents to be able to prevent foreclosure, prevent eviction, if they have any sort of fair housing issues, right, related to ADA accessibility, breaking a lease as a result of a domestic violence situation, all that, they can reach out to us and we'll refer them to the Gulf Coast Legal Assistance to guide these residents through those difficult times. Other services that we provide currently relates to homelessness initiatives. So the Board of County Commissioners have been very supportive, as Commissioner Ballard alluded to. There are several streams of new shelter facilities being built in Manatee County. But while these shelters are not yet up and running, what we have been doing as an interim is providing housing vouchers in partnerships with our local nonprofits to prevent those families to being unhoused, and also as a way of making it easier for them to connect with the tenant-based rental assistance programs. So we can keep them in a hotel, we provide them supportive services while they're there and while we're assisting them in finding housing, in which we're also providing rental assistance until they can become self-sustaining. And another avenue of initiatives that we have in community development are constructions. So we provide grants to local nonprofits if they need to expand their facilities, improve their facilities, to better provide services to our low-income population. So currently, the Board of County Commissioners have been allocated a lot of these funds to improve the residential facilities for foster children. As Commissioner Ballard alluded, these are, the most vulnerable residents of our county, and we're very proud to be able to provide those funds in order to have them being housed in a better situation. Other initiatives include the rehabilitation of our domestic violence shelter through the Hope Family Services. So they, wear and tear, hurricane impacts. Our domestic violence shelter needs improvements, and we are in the process of rehabilitating that shelter. Other initiatives that we do, currently we just did the ribbon cutting for a new community resources center, the Samoset Resources Center. It's in partnership with Centerstone, and it will provide additional mental health and substance abuse treatment to our residents, and that, again, to prevent, families from being separated, to give our members of society a better, more sustaining way, self-sustaining way. And then lastly, we also provide several funding for general infrastructure. So currently, I don't know if you're familiar with the Washington Park construction in Palmetto. So Community Development Block Grant, it's funding over half of the phase 1 of that project. So, and we hope it will soon be opening. It's been a long project because of several, environmental issues that we have encountered, but those funds are for that, to address environmental issues that we find on site, make it healthy, and provide, especially in lower income neighborhoods, better access to infrastructure. And with that, I think this is our contact information. Thank you very much for having us here. And we'll be here if you have any other questions. Thank you.
Thank you, guys. Okay, up next, we are going to have Christy present for Children's Services. Yep. I got it.
Oh my goodness.
This is what you want?
Yeah,
Stand up?
yeah.
We got it, girl, we got it.
That's how I'm feeling too.
Never a dull moment.
As Julia was speaking, I could feel my heartbeat picking up because I don't like public speaking. I like sitting down with you all face to face. My name is Christy Hagan, and I'm the Children's Services Coordinator for Manatee County Government. I'm not used to doing all of this. I have a team that usually does it for me. Okay, next slide. So Children's Services is a division of Community and Veterans Services. I noticed when Commissioner Ballard and Julia were speaking about children's, they looked at me. So that's because I'm part of that division.
I can help you click.
Oh my goodness, that would be cool. I'm actually going to look here. So in support to nonprofits and the Children's Services Advisory Board, the Community and Veterans Services Children's Team is dedicated to supporting Manatee County's children who are abused, neglected, at risk, and disadvantaged economically. Facilitating a variety of public meetings, conducting program site visits and monthly desk audits, participating in a variety of outreach efforts, and being available for nonprofits, families, and citizens. This team of individuals is willing to do what needs to be accomplished to meet the needs of our youngest citizens. Next. So we are guided by the Children's Services Ordinance. There's a copy of that in your packet. There's a dedicated millage to fund, develop, and provide for the operation of nonprofit or county programs for the prevention and treatment of Manatee County's abused, neglected, at-risk, and economically disadvantaged children. So I'm going to say that many times today. Those are our focused children. They are prenatal through 17 years, or it can be services to the family on behalf of the children. We require several forms of verification for services, including, but not limited to, verification of Manatee County residency, age, and their associated risk factors. Next. The advisory board is a big part of our division. It's a group of 13 individuals. They're very dedicated, and they provide their experience and knowledge to our division related to children and the needs throughout the county. The time commitment of an advisory board is very extensive. From February through May, they're reviewing applications and participating in weekly meetings to discuss funding options. And then they determine recommendations and provide them to the Board of County Commissioners for their review and consideration. The remainder of the year, they have monthly meetings as well as an annual retreat. And oftentimes we do have subcommittees that are focused on certain topics. And in your packet, there are some of those. Postings, we will have some openings. Those postings will be available in July. Next. All right. These are the priorities. It says that they're for 24, 25. These are actually the priorities for for 26, for next year. Another task the CSEB undertakes is reviewing the needs of children and establishing these priorities. While there are dedicated priorities, these are not the only programs that are served. Investments can go out to other programs serving at-risk, economically disadvantaged, abused, and neglected children. Different order. So the changes from 24 to 25 to 26, which is what these are, we just combined two and made that top one, children are safe in their home free of abuse and neglect. So that's under one umbrella. And then we added the bottom one. So a new focus is to prevent child deaths. Next. All of our programs provide prevention and treatment services for children and their families on behalf of the children. So it can't be just the adult services. That would be another division within our department. And they fall into okay, so I don't think that they're in there. So they fall into these categories. Children's service program areas are early childhood care and education, food and shelter, mental and physical health and safety, special needs, stabilizing the family and parent education, and youth development and success. So that slide's not in there. These categories are different than the priorities, but they demonstrate where the funding is applied. Youth development and success includes school programs, alternative education programs specifically for at-risk youth. And special needs includes disabilities and developmental delays. Next slide, serving children. Yes. There we go. For this current fiscal year, which runs through September 30th, the Children's Services Millage has provided approximately $17 million to local agencies serving Manatee County. So the just over 17 million, I think it's 17 and a half, is through applications. That doesn't include our emergency funding or special initiatives that have been instituted. Next, here is our process. So currently we are at The CSAB just completed their recommendations, so that's that bottom right. They're going to be presenting those to the Board of County Commission on August 6th during a meeting, and the commissioners will review and either approve or make their amendments to those recommendations, and then we'll move into contract negotiation. You can see our process is a loop, so depending on the time of year, we're in one of those, in addition to our other tasks. Any nonprofit agency that serves children or family on behalf of the children that wants to be considered for an investment must submit an application. And that application period is about 8 weeks long. Staff then review the application and the uploads to make sure that all the documentation is provided. And then the CSEB begins their review, February through May. In May, that's when the recommendations are created and brought to the Board of County Commission in typically July. They're not finally approved or finalized until after the final budget hearing, which is conducted in September. But in the meantime, staff will start drafting those contracts based on a template that's approved by the county attorney's office. Next, emergency funding. So we do have emergency funding as an option if an agency runs into a situation where some of their funding has gone away. State funding, federal funding, and they need to replace it. So we don't allow supplanting, but if the funding has been terminated for one reason or another, and I'm sure many of you know some of those situations are happening right now, they will reach out to us. The emergency funding process starts with a nonprofit reaching out to Children's Services. We provide a link. They have to meet all of the criteria. They have to provide a letter and all of their budget information and a reason why it wasn't anticipated that this would happen. And finally, mine was definitely not 15 minutes, but we're going to go through that packet that y'all are looking at. So thank you for hearing what I had to share. Questions will be at the end of the presentations if you have any. And I gave you my card in your little packet if you would like to reach out at any time. So the book is our annual report and plan. It covers 3 years. It covers the past year. So currently we're in fiscal year 25. So it has the results from fiscal year 24. It has what's currently happening right now in 25. And then it has the plan, the targets for 26. In your little binder, you have my business card. These are all of the programs that are funded for this current year. With a small description. I gave you a copy of the ordinance that has been in place and what we work through. And then the final one, this is one of our initiatives. So that new priority, the one to stop preventable child death, we initiated Sleep Baby Safely. That's around the community. It's been doing well. And that subcommittee chose to focus on drowning prevention as well. So we have, this was our first effort in that, and that's to provide door and window alarms to families with children 0 to 5 or families with children 6 and older with a diagnosed disability. Most of those drownings are falling into that 4 and under. That's why we have that age range. I'll bring some down for the end if anybody is interested in having one, but you do have to meet the criteria that's listed on that form. You can share this with family and friends, neighbors, anybody who has children, and a significant water source that could be a hazard to them. So they get a 2-pack of alarms. They have to promise to use them and have not already received one, and then they'll get a lifesaver badge. So this is for somebody who is watching children in the water. If you have that, you're the designated watcher, and you are in charge of watching all the kids. You know how people get, we get chatty and don't always pay attention, so this makes sure that there's somebody that's doing that. All right, that's all I had. Did I say who I was? Christy Hagan, thank you. Johanna was part of my section, and she's part of your group.
Yeah. We're a little bit ahead of schedule, so we're going to collect your questions right now if we can.
I'm not clicking for everybody.
So let's collect your questions, and then after that, we will have our division go. Yep. Thank you. Thank you. Already got from you guys. Good. All those up there. Okay. No more post-it notes from anybody? No? Only 30. That's good. That's a good start. All right.
Only 30. That's good. That makes
Good
them
questions.
listening.
Exactly.
And listening and having reading. That too.
Okay, we're going to start with Neighborhood Connections.
Oh, good. Perfect. Well, I'm Debbie DeLeon, and I have the privilege to lead the Neighborhood Connections Division. And we all do great work. I always say that we're the division, we're the people's people, because we have the opportunity to work with neighborhoods throughout the community, the county. And our mission is, what we do is all things neighborhoods. So it ranges, and it's different depending on where we go. But our mission is to help neighborhoods become a better place to live. And there's also a little statement in there I forgot. Neighborhoods that are willing to help themselves. Because we have learned in doing this work that although we want it, because that's what we do, we can't want it more than you all, the people that live. And that seems reasonable. So, well, what do we do in this division? We work with residents to improve and maintain the quality of life in their neighborhood. We have several grants. The Neighborhood Enhancement Grant that we'll talk a little bit more about. We have a Neighborhood Action Plan grant, and we have areas that have received a Neighborhood Action Plan, and they have been approved by the Board of County Commissioners. We also have a magazine, or a newsletter we would call, that is called Neighborhood Connections. We attend your neighborhood meetings. There's a group that we go monthly, and we would also go, if asked, to explain what the county offers. We're a liaison between Manatee County and the community. We also put together this beautiful Citizens Academy. This is our second one. And then we also, I don't know if any of you went to the Manatee County Neighborhood Summit? Okay, so several did. We have the privilege of putting that together for the community. We partner also with other county departments. I call it, we're the party planners. Why do I say that? Because we have within the county subject matter experts. They're all doing different things, just like we've talked today. All the divisions do different things to help the community, of course. But they seek us, because we're the people's people, to go out to neighborhoods, especially if they're in a specific area that they want to meet with. And then we plan the party. We invite you. We go out to your neighborhood. We let you know. We flyer the neighborhood. And then we're also, the day of the meeting, we convene a meeting. We're there to welcome you. And then we have the subject matter experts. So we get to socialize with the neighborhood and get to know them better. And at the same time, they're able to get the information that they want. So basically, this is what we do in this division. However, I have the privilege of working. We're a mighty group of 5. You have met, and probably you consider one of the most important the person is Laura. She's wonderful. We all know that. But she's not here today, so you got us. But, okay, next slide. Thank you. We also have a section or a group or one person really that does what we call GIS, which is Geographic Information Systems, and that's William, and then Michaela and Jessica will follow. So here we go.
Hi, good morning. I'm William Corbett, and I am the GIS Systems Analyst for Community and Veteran Services. And so I'll give a brief overview of what GIS is and what I do. So GIS essentially connects data to a map to make location-based decisions. And so one example would be mapping out the library card holders within Manatee County, and so that will help us decide where we want to build a new library. Another example is I also create community surveys, and for, let's see, so the surveys are for if you're for or against a community garden in a neighborhood. It will go out, flyer a neighborhood, and so then we'll get the information, and then we'll decide whether or not to build a community garden. Another project that I made a survey for was for road resurfacing in a neighborhood, and it was if they wanted to add bike lanes or not on the road. And so what we did is I added the parcels of the houses that were affected by that road resurfacing, and the individuals that we flyered could select if they were for or against adding bike lanes. And then, so that will help us make a decision whether or not to add the bike lanes. And also I create web mapping applications. And one web mapping application was for our neighborhood action plan grant. So individuals could type in their address and decide, and see if they're eligible for the neighborhood action plan grant. And that's essentially what I do. Yep.
Only those, a bunch of things. Okay, my name is Michaela Lindekamp. Some of you I'm familiar with. I facilitate our neighborhood enhancement grant. So I know a lot of you have applied in the past, received it in the past, are familiar with our program. But essentially, this is an up to $10,000 matching reimbursement grant. So you can get approved for, say, if your project's $20,000, you can get approved up to $10,000, and you'll get that back for your neighborhood. Most of the projects that people apply for are usually beautification. We've had invasive species. We've had safety. There's a lot of different stuff that this grant covers. And if you go onto our website, you can do mymanatee.org/NEG, and it essentially kind of tells you a little bit about the process, what qualifies. Essentially, we come out, we do a site visit, you tell us about the project, and then from there, you have supporting documentation that you provide that we follow up with. We review all that. It goes to a group that reviews it, and then it goes to our Board of County Commissioners, and then they approve that funding, and from there, you have a year to complete that project, and you get a beautification project for your neighborhood, or invasives, or environmental, or safety, or whatever it is that you've applied for. And it's a really great opportunity for neighborhoods to essentially make their money go a little bit further and do something good for their neighborhood. And the other one, which Debbie mentioned, that Laura facilitates, is our Neighborhood Action Plan Grant. So essentially, it's pretty much the same process. It mimics the Neighborhood Enhancement Grant program. The only difference is this is for areas that have an approved action plan. So there's, I believe, 5 on here that we have. It's there's an area in Samoset, there's Parrish, there's Rabonia, and then there's Washington Gardens, or Washington Park, and then there is Bayshore Gardens. And all of those basically have pre-approved action plans. And so it's a little bit different because instead of a matching reimbursement, you get the full reimbursement. of the full $10,000. But it's essentially the same things: beautification, invasive species, stuff like that. You just have to be within those zones, which William mentioned. He actually created a mapping application. So if you go on mymanatee.org/NAPG, you can go in there, you could type your address in, and you can see if that's something that your neighborhood would qualify for as part of that grant. They're smaller areas, so not every neighborhood qualifies, but it is a good opportunity if your neighborhood is in one of those zones. But if not, you can always apply for the Neighborhood Action Plan grant, and that kind of covers the county as a whole, and then this one is for those specific ones. Next, we have Jessica.
I would like to say good morning, and it's been a pleasure seeing you all here throughout the past 5 weeks. My name is Jessica Roberts. I do the Neighborhood Connections magazine every month. It's a monthly magazine that goes out. I prefer to go out in the beginning of the month because most events, you want to know what you have to do for the month or what fun you can add to your schedules. So the Neighborhood Connections newsletter basically is filled with resources for our county residents to utilize as far as child care programs, crime prevention tips, as well as programs for adults to do during the day, elderly events. I like to include a lot of the free breakfasts. There's a couple of nonprofits that I like to work with and include some of the things that they offer. And also, we include volunteer opportunities. So volunteer opportunities are important because that's a way for community members to get out and engage with each other. So basically, the newsletter is a resource so community members can get together, meet each other, network, say, hey, what we do, some of our similar problems. And basically, yes, if you have not subscribed to the newsletter, please see me after, and I will instruct you how to do that. And also, if you like to submit things, if you have like a community event, it has to be free. Or even something that you're offering, like if your community is doing like a Feed the Homeless Day, please let me know. We can submit that into the newsletter. And also, we act as neighborhood liaisons. This is one of my favorite things that we do. We are responsible for going out to community meetings and basically acting as the middleman between the county and neighborhoods. So whether that be your HOA meeting, your neighborhood association meeting, one of us go out and basically assist if there's questions or anything that you need answered for the county or if you need to know who to go to. The 4 areas that we liaison is Parish Civic Association, Whitfield Community, which is South Manatee County, and Bayshore Gardens, also South Manatee County, and Rabonia, which is North Manatee County. Yep. And I would like to say thank you. Thank you.
All right, we are going to take a short break.
Well, we are going to talk about human services. And for that, we have the person that handles it. That's the way we roll.
Thank you. Hi, good morning, everyone. My name is Renice Remy, and I am the Criminal Justice Policy Coordinator for the county, and I oversee the sections involving human services, grant management, and anything criminal justice related. So that's just me. So it involves us managing and coordinating various initiatives, policies, and programs within criminal justice and various other systems to promote fairness, public safety, and effective outcomes. So our criminal justice policy coordination also involves policy analysis. We collaborate with various stakeholders. We collect data. We implement various criminal justice programs within the court system, within the community. We advocate for public engagement, so we do a lot of research, again, in the public with creating just programs that the county might need. Just go to the next slide. Okay, next slide. So the Public Safety Coordinating Council is the advisory board that makes decisions on criminal justice policies within the county. It includes the sheriff, various elected officials, the state attorney, public defender, county judge, circuit judge, probation for misdemeanor and felony. So this group was established, as you see, back in '92 by Florida statute to oversee criminal justice policies and needs within the community. Within the criminal justice section, we also oversee some state and federal grants. They are formula grants, so that means that they come direct to the county based on population and based on crime trends. So year to year it changes, and the Public Safety Coordinating Council has the authority on making the decisions on how those funds are spent. So these grants come from the state and feds, so it comes from the Department of Justice. Some come directly to us, and other funds go to the state, and then the state disperses it to the county. For this year, we have allocated funds to the Bradenton Police Department, Town of Longboat Key, and the Sheriff's Department. We've created, we've had some JAG funds directly assigned to the bomb squads, the SWAT teams, ballistic helmets for law enforcement, shields for the Town of Longboat Key, and we also have sub-awarded some funds to an agency you've heard of this morning, Turning Points, and they work with clients that are coming back into the community from jail to re-enter into the community. So our Human Services piece, the Adult Human Services piece, manages grants directly related to adults. You heard about the children earlier. So these funds are directly related to adults, so single adult men and women. Some of the programs do serve families, but the main goal is to address the adults and in the community. So some of the areas we focus on are aging services, so those programs that help our older adults, career education and employment, that help people get back into the workplace, facilitate job placement, and just help them to have more meaningful careers. The criminal justice diversion piece focuses on those that, again, are re-entering the community or those that need some type of intervention so that they do not become involved in the criminal justice system again. We also cover services for disability services, so those experiencing some type of disability to just help them have a better quality of life. Homeless prevention and case management, keeping those some individuals kept in their homes, and also providing aid to those that might already be homeless. We also provide legal services, so if you're not aware, if you have a criminal case, you get assigned a public defender, or you can hire your own attorney, but if you have a civil case, you have to hire your own attorney, and that can be costly for a lot of people. So in focusing on some of the legal services, that helps people that might be facing eviction, or some of the elderly that might have been exploited in some way. The Gulf Coast Legal Services and Legal Aid of Minnesota provides free legal consultations and help and representation. So like the Children's Services section, we have, and we go through a similar fund allocation process, if you will. Remember, these funds go directly to agencies, and then the agencies provide the services to the community. So we have an investment period where we say that, we have these funds that are going to be available. That usually happens around December at the end of the year. The applications come in, we review them, and then by March we have scored them. We sit down as a group and we make recommendations to the board on programs that meet the criteria that the board has set to receive funding from the county. So these, of course, are some of the agencies we support. Over this past year, we have provided an investment of more than $650,000 to nonprofits in the area. We've supported over 20,000 clients, and the The goals that each program set, we review every year, and our programs that we fund have a 97% resolution rate. Yeah, I know that sounds incredible. It really is, because these are really impactful agencies, and we do hold them accountable if they say they're going to provide a service, that they do that exceptionally. For the law enforcement this past year, we have allocated over $250,000 to law enforcement, to the Bradenton Police Department and the Manatee Sheriff's Office. And it's my information if you want to reach out or you think of any other questions. I know you'll have some at the end.
The pages that you have that we do not, are they going to be available to us next week, or are they available?
As far as I know, you have this whole PowerPoint, right?
They're putting the questions over there.
Right. But someone was saying she might have been missing some slides, but I don't think so. I don't know. Yeah, you got it all? She has it. She has it. Okay. All right, you're welcome.
Thank you, Renice. Okay, we are going to have Tracy Adams. She's going to present for our aging and eligibility services.
She can prevent aging. Can she be my best friend?
Yeah.
And before she says, I do want to say, Tracy and I have worked for a long time. She's also our deputy director. So there's Sarah as the director, and she's the girl. For the lady.
Hi, good morning. Tracy Adams, Deputy Director, as Debbie said. When I accepted the role of Deputy Director, I said it's contingent on one thing, and that is that I get to continue managing aging services directly. I did not realize when I graduated college that aging services was going to become my heart, but it did many, many, many moons ago. So the county's aging services programs are grant funded by the State Department of Elder Affairs, and we get three main grants from them. It's community care for the elderly, home care for the elderly, and Alzheimer's disease initiative. But I don't have the clicker. Oh.
See, Laura's not here.
Laura's in Iceland, so next week I want everyone to ask her how Iceland was, because I'm sure she's going to have amazing pictures.
So those first three programs, they're all designed to have individuals age in place, to keep folks in their home for as long as possible. Nobody wants to have to leave their home for reasons that can be prevented. We are considered the lead agency in this county to receive these funds. Every county in the state of Florida has a lead agency that administers these same programs. So you will find these programs statewide. Most of the time, it is not a county government that is the lead agency, but I believe there's three of us in this state: Hillsborough County, us, and I believe Charlotte County. Otherwise, it's a nonprofit that is the lead agency. And then we have emergency home energy assistance for the elderly. I'm going to talk about that a little more in depth before we go to the next slide. That is an assistance program for households that have at least one person age 60 or over and are experiencing an energy crisis. So that means they could have a past due electric bill, a final notice, they've been shut off, or they owe a deposit either to have electric turned on or to keep it on. So there is an income guideline that has to be looked at and passed in order to qualify for the assistance, but we do have those funds, and we look at the whole household size, but you just have to have at least one person 60 and over. So I'm going to do a little side plea that if you know of anybody who needs help with their electric or it could help them, we've got money this month that will go away after June 30th, and we'd like to spend it, so you can have them reach out to us. All right. So some of the services in those other categories, programs I talked about, are all things provided in the home. We here at the county provide case management directly. Everything else we contract out to agencies throughout the community to go into the home and provide. So those things are like homemaker, someone to come in and clean the house, do the laundry, go grocery shopping for someone. It can be all of that, some of that, whatever the level of need is. We have personal care, which is assistance with bathing. It could be as small as just there to make sure that person is safe while they're bathing. They might not necessarily need help with the physical aspect of bathing, but they're unsteady on their feet, or they have to step over a tub ledge to get in, and they cannot do that safely on their own. And so they can be there just for monitoring, all the way to if they can't wash their hair or bend down for their feet, any kind of task. That also includes like helping them keep their bed linens clean, their skin care, and things of that nature. For folks who live alone, we have emergency alert response. That's the I've fallen and can't get up. So we have that service for them. When there's a caregiver involved, we want to take care of our caregivers, because if you don't have a caregiver who's healthy and can maintain themselves, now we've got two people who need help instead of just one. And so we do have respite care, an aide to come in, sit with the client so that the caregiver can get a break. They don't even have to leave the house if they don't want to. They can go take a nap, or they can go have lunch. They can do anything that they want to, knowing that they are relieved of the care of their loved one. And then we have home delivered meals. We also provide during hurricane season shelf-stable meals for individuals so that they can make sure that they have something should they lose their electric for a period of time or something like that. But the home delivered meals, they are frozen. They used to be hot, but when COVID hit and they could not be delivered every single day, Meals on Wheels, that's who we use locally, changed to a frozen meal. So once a week, they'll get a delivery of a frozen meal that can be microwaved and stored in the freezer. We have adult daycare that can serve two purposes. It can be for an individual who's isolated and needs some socialization. They can attend adult daycare to be around others, have activities, or it could be used as a form of respite rather than receiving the respite in home. If a caregiver is working and they go to work, their loved one can go to the adult daycare center, and that could be a form of respite. We also are able to provide some medical supplies. Those are very expensive, so incontinence supplies, nutritional supplies. In the past, we used to maybe do that once a year, but the legislation in Florida has increased our program amounts. So we're able to do that on a regular basis now, which is very helpful to people's pocketbooks. We also furnish our clients with hurricane-ready backpacks as well when they come on board with us. So they have water, one of those weather radios, things like that, so that they can be paired not just with the shelf-stable meals, but also some supplies to get them through a few days. Oh, our home care for the elderly program, that is a financial assistance, our only financial assistance program of the three. So if someone has chosen to take care of their loved one at the house and they meet a certain income level, then that caregiver can get a $160 stipend each month to go towards the cost of caring for them at home. They can also be reimbursed for out-of-pocket expenses. They just have to turn in their receipts, and we can reimburse them for medication co-payments. We can reimburse them for incontinence supplies that they've purchased, but they do have to come up with the money up front for that program, but we'll reimburse them. We do have a local elder helpline. You may see that there's a statewide elder helpline number, which that's just as good, but sometimes it's easier to call the local one. That's a 24/7 number. You can leave a message any day, any time of day, and then one of our aging services staff will call you back and try to link the callers to resources. We get a lot of calls from individuals who have parents or loved ones who live here and they live in another state and they just don't know what's happening or what we have to offer. But that is a hot line. There's not one day that goes by that we don't have messages on that line. Okay, so that's our in-home services. And the only thing I want to say about that is we Somebody at one point in the presentation said formula. The money that we get is formula based. They look at demographics of age, and they look at like disabilities, and then somewhere in Tallahassee someone decided on some mathematical equation that tells us how much money we get based on all of that. I will say this, unfortunately it seems like no matter how many clients we enroll, our wait list continuously grows and seems to hover at around 600 all the time. Okay, so then we also have some eligibility services, and some of these are mandated by the state, but unfunded, and some of these are programs that the county developed many years ago. So we have an indigent burial program. Anybody in here did you know that the county has a cemetery? Yep, so in Palmetto, and if there is a deceased person and there's no one to claim that body, then the medical examiner's office or the hospitals will give us a call, and the county has a fund, and we will pay for a cremation, and then we will utilize our county cemetery. The other part of that program is if a person deceases and there is family, but they have no funds, we, if eligible, will pay for their cremation, but they get to keep the ashes. But a person does have to decease in Manatee County. And every county in the state of Florida has to have an indigent burial program. That is a state mandate. We have an ambulance fee assistance program. It's really expensive to use the ambulance in Manatee County, and unfortunately, and particularly Medicare does not cover all of it. Sometimes Medicare will not cover any of it. If you are not transported to the hospital, that's a great thing. You didn't need to, but then Medicare will say, well, we're not going to cover any of it. At best, they cover 80%. So a person can apply to see if they can, at any age, they can apply to see if they can get some relief from the ambulance bill. It's a sliding scale, so it could be you just don't qualify to get any help, or maybe 10% is waived, up to 100% of it is waived, but it is income and asset based. And you do have to be a resident of Manatee County. So if something happened to you and you had to use an ambulance and you don't live here, unfortunately, we can't help you with that. There's also a state mandate. It's called Healthcare Responsibility Act. So if a Manatee County resident who is uninsured utilizes emergency services at a hospital outside of Manatee County, that hospital can send us an application on the patient's behalf, and then we will see if they qualify for a portion of the services that they received at the hospital we would have to pay for. And then prescription assistance for individuals 18 and up who have no coverage whatsoever. Again, it's income-based and asset-based. Then they can get prescription assistance for 6 months, and in that 6 months' time, they're supposed to try to find another avenue in which to get their medications. That's our contact information, and also the Elder Helpline. You can call us at our main number, our Elder Helpline, and we'll have somebody call you back. Thank you.
All right. Now we're going to have Jack present for Veterans Services. Yes.
I'm actually presenting today on behalf of Renee Medina. She is the Veterans Services Division, and I'll be filling in for her today. Good morning. My name is Jack Ruark with Manatee County Veterans Services. You will notice that I did not say VA, Veterans Administration. Veterans Service is a county government office that is mandated by the Florida state statute that each county will provide an office and staff that are trained and accredited with the VA to provide services for the veterans of that county. There is someone in every county that does my job. While many of you might not be veterans and think this presentation does not apply to you, however, do you know a veteran? Neighbor, friend? If so, it applies to you because you can pass this information to those who don't know, especially in their time of need. Let me see if I can figure this thing out here. Hey, we're on a roll. First and foremost, we are a benefits office. We assist veterans who live or work in Manatee County and their families with the often complicated task of determining eligibility and applying for VA benefits. There are 4 main benefits that we work with: service-connected disability and compensation, non-service-connected pensions, VA health care, and VA burial. And the work for the benefits does not stop when the benefit is granted. We assist with future increases as the disability gets worse, causes other issues, or the claimant's need for care increases. In case of the service-connected disability, we submit appeals for those benefits that are not granted. There are approximately 40,000 veterans in Manatee County, and the goal of our office is to support and empower each of those veterans. It takes a lot of outreach to ensure this information is getting out there. But we do so much more than that. You heard all the other agencies talking about different agencies that they work with within the county. We use those same agencies to refer our veterans to when they need legal help, they need food, they need shelter. A lot of the same organizations that we all use, we also use for veterans, and then we also use the VA and state benefits as well. These are complicated benefits that are not based on what you think, know, and feel. They are based on what you can medically prove. We assist you with gathering the evidence required to win your claims. The VA will tell you that you are a savvy soldier or sailor and provide you with a portal to submit your claims. What they do not tell you is what evidence should be provided with your claim. When you submit your claim without evidence, it's taken out of the fast lane, which is 4 to 6 months. And because they have to ask you for additional information and things, all of a sudden that claim is now taking a year to a year and a half. Our office uses what we call an intent to file to allow you time to gather evidence to win your claim, which puts you in the fast lane for decision making and gives you the best chance of getting your claim approved the first time. Why do we do this? Because a benefits grant can open up the whole world of benefits and open up eligibility for benefits for veterans or their dependents that they would not otherwise qualify for. Often veterans' families move here from other states where they're not aware of state and local benefits that they qualify for. Even if you're 100% totally and permanently disabled, there will be benefits that they now qualify for, and they're probably not aware of it. We can help veterans that does not qualify for a bar today is not a bar forever. It's just a bar until the requirements are met. Uh-oh, I broke it already. There we go. I guess you got to push the button to make it work. Our goal is to make contact with all 40,000 veterans in Manatee County and provide support to successfully file claims for the benefits each of them have earned. We also connect veterans to programs that are paid by the VA and the county to assist veterans with other things that our office does not. Veterans' benefits are complicated, convoluted, and hard to understand. Our office speaks the VA language and helps you interpret what the VA is telling you and what they need to win your claim, qualify for benefits, and get the services you deserve. Has anybody ever dealt with the VA here? Am I right? Yes. Veteran service counselors are all required to be veterans. We have all served during a wartime period, so we understand the rigors of serving in the military and the toll it takes on your body and mind. We represent each branch of the military in our office and have over 100 years of experience in the military between us. We have been in your shoes. You have a choice of who you use to assist you with your VA claims and VA-related issues. There are post-service officers, American Legion, the VFW, they all have post-service officers that work in there. We also have Florida Department of Veteran Affairs reps at the VA clinics. The VA is located in Bay Pines. They are knowledgeable to a point. However, there are many more reasons to utilize our services. For long-term relationship, to ensure you are always clear with what's happening with your VA benefits, what resources are available locally for your current needs, and to ensure your VA status is where it should be. I'd like to thank you, and I'd like for each person to take one of those pamphlets, whether you know a veteran or not, take one of those pamphlets. If you run into any veterans anywhere and they say, I've already tried, I've already worked with the VA, they denied me, send them to our office because that's what we take care of. And I want to thank all the veterans here and the veterans' families.
All right, now we're going to have Matt presenting for Animal Services.
Thank you. All right. I'm going to have, if you could help me pass.
Are these the same or are these
They're different. They're two different. Good morning, everybody. We all like to talk about animals. That's a fun part of, how many of you have pets at home? Quite a few. So whenever I have an opportunity to speak in public, it's a fun, exciting topic because we all love, most of us have pets at home. I have a 16-year-old foofy little princess who runs the middle of the house. She's the princess of the house. I was a former educator for 20 years, and so I always say there's not a lot of difference between animals and kids because they all have needs. They all get hungry. They want attention. They starve for attention and love. So today I'm going to talk about Animal Welfare Division. We were once part of public safety. So we've kind of changed recently within the last year or so. We moved under Community and Veterans Services. And we kind of think of it as those students who are learning in elementary school, a community helper, like a police officer, a firefighter. Those are community helpers. And so we kind of look at it as Animal Services also as a community helper. We're here to help our citizens, and we're also here not only to help with our pets in our community, we're also here to enforce our Manatee County animal ordinances. So here are the services that we provide. We enforce the animal ordinances that we have. Sometimes we get random calls. A neighbor may have concern about the well-being of a neighborhood dog or cat or animal. Sometimes we'll get, the other day I got something mailed to our office that someone was concerned about a horse that they felt that was neglected. So whenever we have those concerns, we have our animal division, animal control officer division. Sometimes they'll be called out to inspect or kind of do a little check, a wellness check, or follow up with complaints from the community with some of our animals in Manatee County. So we also lost or stray animals. We'll get calls. We have a dispatch number. So if you're in your community, you go home this evening and you see a random dog that's walking in the neighborhood, you can call animal control. We will send out an officer and hopefully be able to get that animal and bring it back to our Bishop location. So most of the services that you see on this front PowerPoint are located at our Bishop Animal Shelter. And everyone always asks me, people get confused about there's Palmetto, there's Cattawn, there's Bishop. They get a little confused, but we're all under the same department. We just have 3 locations. Varying off a little bit, we are in the process of building a new adoption center for all of our dogs out at our Bishop location, which is right across from Blake Hospital. But currently, these services predominantly take place at our Bishop Animal Shelter. That's where our animal control officers are stationed. That's where our medical team, the next one is medical services and community outreach. So for example, if we get a stray dog or cat, they go on a hold at Bishop. Once that stray hold is up, they then become property of Manatee County. And then our medical team evaluates that animal. If they need to be spayed or neutered, they are put on the docket for that procedure. They're vaccinated. They have all their up-to-date shots. All of our animals are microchipped. So when all the cats, predominantly we're talking domestic, we do, I don't know if you remember hearing in the news last year, the rabbit hoarding case that made Fox National News. We had over 100 rabbits that we confiscated. They were obviously in a terrible condition in a home. And so our officers went out, we took those rabbits, and those 100 rabbits or so turned into 130 or 40, 150 rabbits, because many of them were pregnant. So it was when you adopted a pet in Manatee County, you could also have a free rabbit if you wanted. So we do, believe it or not, we do get some rabbits, guinea pigs, different things of that nature. But once those animals, once the stray hold is up, once our medical team has evaluated that animal, provided the necessary medical care, all of the dogs currently go all the way up to the Palmetto Adoption Center up in North Palmetto, and then all the cats go over here to Cat Town, which if you've never been to Cat Town and you just want to go in and just, I call it the country club for cats and kittens, because it's a wonderful place. So that's kind of the process. We also work with different organizations, different rescues, humane societies. If there is a time where we are over capacity, we have a population manager that networks with all of our different partnerships to try to find another home for these animals. We have different rescues that come into Cat Town and they'll just start shopping for kittens. And so, we're at 100 kittens and cats, and the next day we're at 70 because they took 30 off of it. They took 30 from us. So that's some of the things that we do. And I am, again, the volunteer coordinator, so I deal a lot with our volunteers. So the community outreach aspect, again, the foster and adoption of available animals. You probably heard in the news recently, we just had our Adopt-A-Palooza. That's a term a lot of people here in Manatee County. I think we had about 15 dogs that were adopted this past Saturday at the Bradenton Area Convention Center. Today, we actually have an event, and tomorrow in Plant City. It's called the Mega Adoption Event, where you have Pasco, Orange, Hillsborough, Pinellas, different municipal shelters that are participating in that big event at the Plant City Convention Center where the Strawberry Festival is. So when I'm done here, I'll be heading up there to assist with that adoption event. So the next item is volunteer opportunities. We do have, if some of you ever have an urge to volunteer and want that extra time with a kitten or a cat, I work with volunteers from as early as 13, 14 years of age, all the way through high school. We have students in high school that want to earn bright futures, who want to go on to college, and it's 100 hours of volunteering to earn that scholarship if you maintain a B average in high school. So we have a lot of high schoolers that come into Cat Town, and that's a wonderful place to get their 100 hours for bright futures. But we also work with, I have doctors. I have a doctor at Manatee Memorial that volunteers. We have teachers. We have people from all walks of life. We have retired military, psychologists, the gamut is, it's amazing how all the different people that I meet who want to give back to our community with the animal services. Another big community outreach is our community food bank, and you'll see a lot on social media, a need for our community food bank, and that's a service we provide for those who are having a difficult time caring for their animals, specifically more so food. So both of our locations, Palmetto and Bishop, we have people that come in on a regular basis that need support for providing food for their animal. So we do a lot of networking. I work with different schools, different clubs, organizations that network and fundraise to bring us food for our pantry, which goes back right to our citizens here in Manatee County. So we also work with, I'm going to give a shout out to our Friends of, sometimes you might have heard of this organization, they're called Friends of Manatee County Animal Welfare, and they're a non-for-profit. And the only reason they exist is to support the animals here of Manatee County, those that are in our care. They provide treatment for heartworm treatment for all of our dogs that have heartworm treatment. Any dog that's up for adoption, that has an orthopedic impairment, for example, or we call it an AC tear in a human in our knee, but if they have, I don't know the medical term off the top of my head, but different ligament tears and such, they will provide for those specialty surgeries to help make our dogs or cats more adoptable. And so we work with them on a daily basis, and they provide a lot of funding for Corunda beds, which are the beds that are in our kennels. They help keep those up and repaired. So ultimately, they're helping the animals here in Manatee County. Population management, I spoke a little bit about networking with other organizations to help with overpopulation in our shelters. And then we always follow best practices in sheltering, Friends of, organization that publish best practices in sheltering and caring for animals, medical, the whole gamut. And then 3 of our locations, again, as I mentioned before, the Bishop Animal Shelter is basically our animal control division in medical services. Dr. Johnson is our veterinarian here in Manatee County. She's a Manatee County government employee. She's our veterinarian. And sometimes when I work with different schools, we do different field trips. I've actually taken a group of students into medical while they're having surgery, and they're able to just look in and see a dog that's being spayed or neutered. So it's an interesting part for kids to understand too, the importance of taking care of our animals. And I never understood watching growing up The Price is Right. And at the end of Price is Right, Bob Barker would always say, don't forget to have your pet spayed or neutered. And I couldn't understand that as a child. I was just like, why is he saying this? But actually working in animal services, understanding the importance of that. Because it does take a toll on our county. It takes a toll on our taxpayers. And then, of course, our Palmetto Adoption Center is in Palmetto. And we will be locating sometime December, January, or 2026 to our new shelter in Bishop. So we'll eventually all be on one grounds, one location. Palmetto will no longer exist. And then, of course, as I mentioned, Cat Town. So that's kind of animal welfare in a quick summation. Director Brown used to be the head of animal services. Now she's moved up to be the head of our department here. So if you have any questions, please let us know. We'd be more than happy to assist. I also gave you a couple cue cards that kind of give you information on where our 3 locations are at. If anyone has if you know anyone that wants to volunteer or anything, there's some good information on those cue cards. So appreciate it. Thank you.
So I just wanted to add something to this because it's something that I, as Tracy's super passionate about seniors and aging services, animal services has always been a passion of mine. I was in animal welfare for 20 years. But something super cool that we are doing here in Manatee County that is not something that municipalities usually do is trying to find ways to prevent animals coming into the shelter. We talk about pet overpopulation, spaying and neutering, and all that goes along with it, but trying to keep those animals out of the shelter altogether. So next year, we are opening a resource center. We have surveyed the county to find out what are the reasons pets are coming into the shelters, and it's the same thing over and over again. Accessible vet care, because vet care is very expensive right now. As you know, if you have pets, it just keeps going up and up. It's because there is a national shortage with veterinarians, so they can really charge you whatever they want because they are paying those veterinarians ridiculous salaries now. So there's one clinic that we're trying to recruit a vet a couple of years ago, and the clinic offered her a $100,000 sign-on bonus. I'm like, yeah, so we can't do that. We're county government. We have to be good fiscal stewards. So it's a continual problem with the veterinary care. So we're going to start to offer that. Also behavior training. That's another reason animals are coming into the facility. So we're going to have a trainer there on site. We'll have caseworkers there and pet food pantry. But we're super excited because we're hoping that's going to start giving people that ability to be able to keep their pets, keep them in their homes so it doesn't flood the shelter. So anyways, I won't keep doing this, I promise.
actually, since we are so far ahead, we're going to take a 5-minute break to give our presenter time to come across the street from the courthouse. So if you guys can be back here at 10:50. If you guys. All right, everybody, are we ready? Okay, we are going to have probation present. We have Jennifer here who's going to tell you a little bit more about it. And then you have the clicker right here.
Oh, I probably don't need it. It's probably just the one side, I think. You just put it on the one. That's it? That's the whole thing?
Oh, wow.
I probably have a big enough mouth, but. Good morning. Can everybody hear me? Hi, Jack. Oh, Chrissy, I didn't even see everybody. I was too busy talking in the back. Okay, good morning. It's good. I have a big mouth, probably can hear me anyways. But, okay, so my name is Jennifer Berg. I'm the Probation Services Manager. I work over in the Judicial Center, which is across the street that way. I'm not good with directions. It's over there. Okay, so is the slide up? Okay. So we have misdemeanor probation. She's pointing out. I can't see. Oh, thank you. My boss is back there. So I always need a little bit of help with directions. So we have misdemeanor probation. So what the misdemeanor probation unit does is they enforce the court orders with regards to whatever the court orders the clients to do. We supervise all the conditions while they are in misdemeanor probation. Occasionally, we will get a handful of felony cases, not too many, a few here and there. Every once in a while, a felony judge will ask us to supervise a felony case. They feel like it's more suited to the misdemeanor division rather than the felony division, but not too many of those. Our pretrial release program is a program that we have. So when people are arrested for a crime and they are unable to post the monetary bond, or in addition to the monetary bond, sometimes the judges will allow them to be put in our program and be supervised in the community while they're waiting to go to court. So if they don't have the money to post the bond, or sometimes if it's a more severe crime, they can post a bond and be supervised, then they come in and see us in the office, and we check in and we make sure that they're going to court and they're staying on top of the things that they have to do before they go to court. These clients have not been convicted of a crime. So they are going to court, they see us all the way up until they're done with their court case. So we see them sometimes as little as a month and sometimes as long as 5 years. So it could be quite a long time. The years ones are not too often, but we do have a handful of them that we do see for that long. It's more often that we do see them for several months and then their cases will take care of themselves. But we do have a handful of them that we do see for several years, and we get to know them quite well. The offender work program is a sentencing alternative that the judges have for people that do get put on probation, and that's an alternative to putting them in jail. So rather than going to jail, which costs $101.56 per day at the jail right now, Manatee County's finest, which is a really nice jail, but still don't want to go there. So instead of going to jail, they can work at our offender work program. And to do that, they get to pay $20 a day. And they go out and they take care of a whole bunch of Manatee County properties. So if you are a Manatee County taxpayer, that is a big savings to the Manatee County taxpayers, because Manatee County is not contracting people to take care of those properties. We are using clients to take care of those properties. So that's a huge savings to the taxpayers. So we're not putting them in jail and the taxpayers paying it. They are paying to work in the program, and then we're not contracting services. So it's a triple win to all the taxpayers. It's a very successful program, and it really helps the clients be able to maintain their jobs and keep doing what they need to do. And we are open 7 days a week, and they can just come any day that they would like. The only days we're not open is court holiday. Not court, I'm so used to court. It is county holidays. So they can just show up and they can put in an 8-hour day and they can just keep doing what they need to do. And then that way they can keep their families on track, they can keep their jobs on track, and they don't lose out on everything just because they have something that they need to repay for the crime that they've gone to court for. Pretrial intervention, this program is for first-time offenders. And by first time, I mean never had anything that you've been arrested for before. It's usually retail theft or marijuana, something of that sort. And so this is a 90-day program that we facilitate for the state attorney's office. And it is a great program because if the client successfully complete the program, the state attorney will agree to not file the charges. So people can actually make a mistake and not have a criminal record, which is fantastic. So it's a great program. They can do what they need to do. They can finish, they can move on with their life. And again, everybody makes mistakes. We all know that. Some do a little bit more than others. Some people don't get caught. Some people do. That's life. So those are the 4 programs that we supervise. In addition to that, we also have a victim impact panel that we have every month for the English speakers and every quarter for the Spanish speakers. That is at our central library. If anybody's interested, it is open to the public. It is an informational session about drinking or using drugs and getting behind the wheel. The information for all of those is on our website. If you're ever interested, I always encourage anybody that has children, grandchildren, anybody that has a problem with somebody in their family, or if you're just interested in seeing it. It is quite an interesting presentation. It's only an hour, and I've seen it, I can't even tell you how many times, and I always find it to be interesting. There's usually some discussion afterwards, and it's still quite interesting to me even after all these years. So again, it's open to the public, and you're more than welcome to come. Bring your friends. It's a good time. Maybe don't drink like downtown before you go, but not that kind of a good time. But we also do go out into the community. We have had a program in the past where we pair with law enforcement and we go out into the community, which we call our special response team, and we help check on our clients to make sure that they're in compliance with their conditions. COVID kind of put a little bit of damper on that because we had so many things change. So we're still working on trying to get that back up and running. And we do still go out occasionally here and there. We're still working on trying to get things back up and running. We would pair with Palmetto, Bradenton, the sheriff's office. Sometimes we'd even go out to Holmes Beach and things like that. Just, again, kind of trying to catch them doing things right. And when they're doing things right, they're so happy when we show up and they're ecstatic to be like, look what I'm doing. It's great. Everything's going great. And it's really nice to help them, get where they want to be. We in our office try really hard to assist people in getting where they want to be. We have a job board trying to help them get jobs when they need them. If people are lacking in any areas of their lives, whether it's jobs, housing, anything that they possibly need help with, we do try to work with them. We have this department that we work in that has all of these resources that you have heard about. And so we are able to connect with all of the people that are in our department and try to work together because we have children and we have elderly and we have all the different things. So we do try really hard to connect and try to get them so that they don't return to us. We like them, but we try not to have them come back and see us. So, like I said, I know everybody says it, but I really do have the best division. They're wonderful. They really are. They're really great people. They really treat people wonderfully. They really go out of their way to try to not have them come back. They really try to not have people, because the people that come in our office are having probably the worst day of their lives or another bad day. And they're struggling and they're having a hard time and they don't need to be told that, they've messed up. They know they've messed up. They're having a hard time. And sometimes they just need somebody to say, you know, what's going on with you. Sometimes nobody's asked them what's going on and why are you having a hard time. You know, sometimes nobody said, what do you need? What can I help with? And sometimes that's the difference in how they can move forward and make a change. And sometimes they don't realize that even the smallest step in the different direction can make that change. And that's what we're trying to do, just like everybody in our department. Every single person in our department does nothing but try to help all the people in Manatee County, which is why we love being in this department.
Thank you, Jennifer. That was a perfect way to sum it up. And I know, Sarah, you wanted to say a couple of words as well at the end. It's always good information.
So something that William was talking about with the GIS reminded me, and it should have reminded me because we were at ABC 7 yesterday talking about this, but during last summer when we had all the storms back to back to back, he developed some surveys for the community assessment teams because we had county workers go out to talk to folks in the community to find out what their unmet needs are. And what you don't know is almost all the leadership in this room serves during gray skies. I serve as the Human Services Branch Director, probably because I used to work in the Department of Public Safety, so it was just kind of an easy fit since I know everybody over there. But almost everything in that branch is part of this department. So not the medical side, but mass care, the shelters, human needs, temp housing, ESF 15, which is volunteers and donations. We have ESF 18. Animal Services is also part of that. So it's really kind of this whole team switches over to that during the gray skies. And something that's really cool that we're working on that has been a part of actually this department before the libraries moved on was the COAD. It's the Community Organizations Active in Disaster. And after last summer, you get those lessons learned afterwards. And we don't want to take those lessons learned and just say, oh, well, that's a lesson learned and move on. We want to take that information and make our response better. So we are doing that, and we're actually teaming up with the United Way Suncoast. They're going to lead our COAD, and they're going to sit in the EOC with our teams and work on the coordination with all the different nonprofits, organizations, faith-based organizations, volunteer groups, civic groups, anybody who wants to get involved with that. So we're super excited about it. United Way Suncoast is 5-county organization, and so they have a really great reach. They also do fundraising for nonprofits after, so anybody who's really involved with that will probably get a little piece of that pie. So it's really important. If any of you know any groups that you think would be great to be involved in that, we have monthly meetings. We have mymanatee.org/COAD. It's a new webpage, gives you information and resources on that. So, we're just trying to make our responses better during those times. Hopefully, because we're planning so well, we're just going to assume that we're not going to have any hurricanes this year. We had our fair share last year, but we want to make sure that we're always prepared. And we felt last year during the summer it was really hard on everybody, but each storm we learned something, and we took that and tried to respond better and better. And so, like I said, hopefully no storms this year, but in case there are, we have some great resources that are coming your way. So that's it. I'm sure I'll say something else again.
Okay, did anyone else have any more Post-it notes with questions? I will collect them now. Lewis? And then, actually, can you bring it back to Jasmine? Okay. Anybody else? No? Okay, so we're going to bring the question board up here, and then we'll see if we can go by division to answer the questions.
And we want to thank Jasmine
for organizing that.
categorize this for you guys. So thank you, Jasmine.
Yeah, so Debbie, Julia, if you two want to come up first since you were first. And then I'll walk around with or I guess you don't have to, because the questions are right there.
Okay. What is the actual dollar income for low and very low brackets? And this is like multiple questions asked. So it is based on the household size. So I will give you, like, for instance, for a one-person household, maximum income for very low is $37,700. And we look at all income coming in. We look at income from employment, retirement, disability, Social Security, any reoccurring payments. So we look at all income coming into the house. Maximum income for low income is $60,300, and then maximum for a one-person household for moderate is $90,480. So, and then I could just do a sample of a four-person household. So the maximum for a four-person household, for the very low is $53,800. For the low income is $86,100, and then for the moderate, it's $129,120. So those are the maximums. If you're a penny over, we just can't help you. That's just how it is. So this one says, I have many questions to ask at detailed level about qualifying for funding for housing programs. So I have business cards, whoever wrote that. They could send me a detailed email. I'd be glad to respond that way. Or you could ask the questions. What is the budget for the housing division? How much of the budget comes from the county versus federal? I cannot tell you, I mean, the housing division, all of our SHIP funding is grant. Our housing programs are run by grants. We don't have any general funds that fund these. So it's our SHIP funding that funds our housing programs, and then we get a portion of the CDBG, the federal funding, and the home funding. So this year, our SHIP allocation is, let's see, just under $3 million. Last year, it was just over $4 million, and the year before that, it was just under $3 million. So I hope that answers the question. And then, what is density bonus? Explain. What is the formula for affordable housing credits for developer? So density bonuses are based on the future land use in the current zoning. So if this parcel says you can put 3 units on this acre, if you have an affordable designation, you then get to put 6 units on this acre. It still goes through the planning department. We really just review the applications and approve the affordable designation, but that is one of the incentives they receive, is that they can get double the units to put on the land. And then the affordable housing credits. So the impact fee credits, we pay all the county impact fees, and then we pay the sewer and water fees. So it amounts to about $15,000 per affordable unit. So, is the affordable housing considered Section 8? If not, how is it related to Section 8?
Thank you. That's a great question, by the way. So, no. The Section 8 is a program that runs through the Housing Authority. It's mandated by them from the federal government. They receive the funding directly. What the county does is, through the federal grants that we receive as an entitlement community, through HUD as well, we have the ability to create several different programs. One of them is called tenant-based rental assistance, and that's what we have been doing. So the framework is similar to Section 8, but it's different. Section 8 is through the Housing Authority. Our tenant-based rental assistance is, we choose to do it through a decision from the board, and the way we do it here in Manatee County is we allocate those funds to our local nonprofits, and they serve the clients directly. So currently, we have Turning Points and the Salvation Army that provides those rental assistance vouchers to residents. In addition to that, we also have what's called homeless prevention or rapid rehousing. These are also rental assistance programs, but they are really for individual, not based on income. It's based on a status. So it's based on a status of being considered homeless or at risk of homelessness. And so you receive additional support, not just, an assistance like the agency paying for part of your rent directly to your landlord. There's more into it. So I hope that makes sense. Are there more?
Oh, yeah, the dental clinic.
We have a question about where is the dental clinic located, and CDI. Okay. What criteria be met to? Okay. So the dental clinic is offered through Turning Points. So it's located in their campus on 15th, 17th. Thank you. And in order to qualify, you must be low income. So the income limit that she just described, depending on your household size, and you cannot have access to dental insurance. So you are uninsured and you're low income. That's primarily the criteria that they use to qualify for assistance.
Homeless initiative, employment, homeless initiative, employment. I think he is right, but here where the new shelter is located.
Okay, so I can talk a little bit about, in general, our homeless initiatives. So there are currently 2 shelters. They're under construction at different phases. So the first one is called Under One Roof. This will be a woman homeless shelter because we do not have a homeless shelter for women. And that's on 57th Street. It's an old sheriff building that renovations are way underway, and I believe the plan is to open the shelter for residents by Thanksgiving, right, Tracy? Around that time, so in the fall. But it's already being used as a service, so to connect with, our different local nonprofits that we provide services through to clients, and other, outreach efforts that we have. The other shelter that's going to be built is called Fresh Start, and that would be for the single men, right? Single men, and it's still really in the planning stages. Our main focus originally was just the woman at this point because women have nothing. And once those 2 are completed, the plan is for our current shelter, which is through the Salvation Army, to be converted into a family shelter. So for families with kids or married couples. But currently, they are the ones that offer a homeless shelter for single men, and they have a small wing that provides services for families with children. So this is where we're at with that. So as I mentioned in my presentation, there are very few resources for families with children, and so what we are doing in the interim is providing housing motel vouchers in partnership with our agencies that already receive rental assistance. And so the plan is, okay, someone reaches out to those agencies, they're placed in a hotel while we help them figure out a permanent housing situation, and we already have vouchers for that rental. So we have, the 2-step process, and then they work their way through becoming self-sustaining and moving on from that. Yes, ma'am?
You mentioned this Fresh Start program, and it triggered something in my brain. What's the county doing about these folks that are aging out, the kids that are aging out of foster care? And how are we helping these
That,
get started?
that's a great question. So we have the rental vouchers that we can offer, as a quick as a shorter term, situation. And currently, it's funny you mentioned that because on Tuesday, the county just approved for one of our grants to be used to build a little village dedicated for studios just for youth aging out of foster care. And that's in partnership with an agency called Harbor 58. And so we're going to start that, hopefully have construction completed next year. So that would be one option. Yeah. That's through the county. I'm sure there are other agencies out there that might offer other options. What else do we have? Down payment.
So the question is, down payment assistant program, how many individuals a year use the program? There's 2 of those. So our state funding requires us to spend 20% of our funds on special needs households, 30% on very low households, 30% on low households, 65% on home ownership, 75% on construction. So we mix all that up into a formula, and that's kind of how we come up with how much we can spend in down payment, rehab, and replacement. So we helped about 25 households last year. It's 70,000 up to. If they need 30,000, they get 30,000. If they need 40,000, we do not give them so much that they get cash back. They cannot get any cash back in the transaction. So it is what they need. So some people might only need 25,000, some might need all 70. So it kind of depends what people need. And then we also get repayments from our funds that we have previously assisted with. So we might get a little bit of what's called program income. So that also goes back into the community, into the program. So, but we have to follow that, those required set aside. So that kind of dictates what programs we use the money for. So last year it was about 25. Hopefully, our down payment actually opens on Monday, or on the 16th, next Monday. So. Oh, and this one. Oh, Julia and Debbie did the best presentation. Thank you. Oh, I don't know who wrote that. Thank you. We appreciate that. So, any more questions for us? For housing? No? Okay, thank you so much.
That's all yours? Yeah. Perfect. Okay. Chris.
Whose are these? There's glasses left up here.
I think I wrote all mine down. These 4. Oh, 5. The advisory board composition, all of that information is in the ordinance. So if you look through that little packet that I provided you, all of the details are right in there, the 13 members. So that one is easy for me to answer.
So it's my question.
Okay.
So I looked at the people, and some people have something that says child advocate, but you have one that says physician. So I'm a rehabilitation person, and I was wondering, you have a mental health person, but a lot of child services, there may be a need for learning specialists, occupational therapy, physical therapy, speech. And a physician gets about 2 hours of training on those allied health professions. So they don't know much about it. So, are there positions for a person with those skill sets to apply, but it's, listed on the ordinance as one position? Would they fit under child advocate?
Yep.
Or?
Yep. A child advocate is anybody who has an interest in serving the community of children. So they might have an extensive background, or maybe they're a grandparent. It might be just something like that. Currently, I think our child advocates, we have a nurse, a mental health professional. So they do have some of those backgrounds. Yeah. The next one. The next one is on Manatee County pregnancy rates. It said at one time Manatee had the highest teen pregnancy rate, and how is the teen pregnancy program, which is run by PACE, handling the contracts that are made yearly? And what is the estimated reduction of pregnancy with this program? Because I don't know that offhand, we reached out to them and got the information straight from them, but then I do have some other resources that you can access to get updates on your own, albeit they are not necessarily the most up-to-date, but you can see the trend lines in those resources. So now I need my glasses. Maybe that's why somebody left theirs there. All right, so it does say that Manatee is among the highest, and that it has over time gone down. The program itself, they serve approximately 110 per year, and in the 30 years that this executive director has been with the program, the most that she's seen in 1 year is 3, so that's over 97%. And then most years, it's at 100%, where there are no teen pregnancies. So the resources that I have, there's one on, I'm going to spell it out, but if you need me to share it with you later, I can. It's dashboards.mysidewalk.com. And it provides a lot of data in different areas. So you can go in there and look up data for children, and you can look up mental health, you can look up pregnancy, you can look up literacy, you can go in there for homelessness, you can go in there for adults. It's vast. It was a conversation that a couple of my staff and I attended with Manatee Community Foundation. So you can see the trend line. What I was trying to show is this trend line here. I'll scan it to you all. So this shows Manatee, Sarasota, DeSoto, and maybe Charlotte, as well as Florida and the United States. Yep, I got all the counties right. And you can see that they're all on the decline. That's probably something that William does too. So that one's done and that one's done. How do you help children in Manatee who are homeless and can't prove residency? For our programs, we do need to have a zip code. It could be the zip code of the shelter that they're staying at. It could be the zip code of the friend's couch that they're sleeping on. But we do need a zip code. Annual investment process. Used acronym for department. What does this stand for? Budget meeting in June. Not tied to this. Whose question? Okay.
So you guys use a lot of acronyms, and sometimes I miss what they stand for. So I thought I wrote the initials down, but I might not have.
No.
It might actually be like this community. What do you guys call this whole grouping? Yes, no, it was not that. It was something else. Yeah.
CSAB?
Yes.
Children's Services Advisory Board.
Okay.
Yep.
All right. So then you have that circle, that like diagram.
Yep.
Process. And so somebody else came and talked to us, and they're like, "We hope you come to the budget meetings next week." So there's some sort of Manatee County budget meetings next week. Okay. So, right. So how does that relate to? Because this seems to be on a different cycle. This was, you said,
It's
finalized in September.
So I don't know if somebody else wants to speak to that. It's all on the same cycle. It's just the beginning conversation of the budget for the year, I'm guessing.
Next week, so it's preliminary.
Yep, and then it goes, the conversations just keep going. So our budget is provided to fiscal. It's thrown into what is provided to them. It's just that our agreements can't be executed until that final one in September. Okay. And I think the last one. How many children are served in an average year. So on page 5 of the annual report, it shows for fiscal year '24 that 28,544 were served. But mind you, this is for all programs, so it might be duplicate services. Somebody might need services for mental health, and then they might also need childcare services, so they're duplicate services. For fiscal year '24, which was October of '23 through September of '24, we had the 28,544. Fiscal year '23, was 30,963. Fiscal year '22, remember that was like in the COVID era, 15,454. And then in '21, 37,329. So again, those could be duplicate services. You look like you have a question? No? Okay.
And what is that, so what is that in relationship to the population of children in the county?
Oh, of children in the county. I would have to work with William on that to figure out what our children population, yeah. Yeah, and I don't know that we could, I don't know that we could get that accurately either because it is duplicate services. It could be that they're served in multiple locations. So we don't provide the services directly. Again, it's like what Renice had said. We have nonprofits that provide those services. They just give us their, yeah.
Real way of knowing exactly how much need on a percentage basis is in the county for that.
Right. We usually look at what the wait lists are for those programs. So if we have a program that has a significant wait list that doesn't go away, that kind of shows us that we need more of that service. So, anybody else? Yes, ma'am?
Okay, so I'm gonna ask this question, so you don't have to be defensive, so my question is this. So you print this annual report.
Yep.
Okay, when you clearly could just put a PDF on the website, but what is this annual report used for? Is it used to get more funding from somebody, or is it a state requirement?
It's a requirement. Yep. And we don't print lots. It just happened that we had some left over from this year, so you all got them.
Well, who do they have to go to in print as opposed to?
So we have other counties that we work with, Florida Alliance of Children's Councils and Trusts, and they typically get some. And then our county commission, our programs, our advisory board. So it's typically less than 100 that we print. We do it in-house.
I understand.
Yeah.
So I just was curious because
Yeah, it is also posted online. They can download the PDF.
We print a lot of stuff that goes into the recycling.
Yeah.
So,
Yep.
but I understand that it's a statute.
Okay, thank you. They can keep talking.
Okay. Neighborhood connections, we had a couple here. One of them was, does Neighborhood Connections work with code enforcement to educate the people regarding county codes? If people reach out to us and ask, we do. And then as well as the Citizens Academy, we will have, I believe, a section on code enforcement talking with public safety because that's the department that they're under. And sometimes code includes stuff in our Neighborhood Connections newsletter as well when they're trying to put stuff out there. I don't know if Debbie, if you wanted to add on that.
Yeah, I think I answered that question with the individual. What I was going to mention is they attend a lot of neighborhood meetings, a lot of coffee clubs with different neighborhoods throughout the county, and they also work in conjunction, maybe you said this, with crime prevention. Because I know we have a quarterly meeting with crime prevention with the sheriff's department, and they attend. So we all kind of collaborate. So there is. And usually, and I will say for code enforcement, and next week will be at public safety, so you'll get to know more about them. The whole idea is for compliance. The county's not trying to make money off of people that aren't doing what they should not be doing. It's really to put everybody in compliance, because code has to do a lot with the safety of us, of all of us, where we live, the neighborhood, and things like that. Not just to, it's always good to make it pretty, but it's all about the health and safety of people. Oh, I've got some. Okay, is there a GIS survey for tree canopy on roadways to help control heat and speed? There is a, I don't believe, I think this is more a development, from Development Services question. So I will leave this one with Laura, and we'll do some due diligence and send back. Then, is there a tree planting program for low-income homeowners? I don't think it applies for actually the homeowners. I think it has to do with the neighborhoods. So not necessarily do we have a program for that. But I will say, nobody's ever brought this up either. So it's a reasonable thing to bring, and maybe something to brainstorm on if there's a possibility.
Probably reach out to keep Manatee beautiful as well.
Okay, that's an.
They just did a post on Facebook about that maybe a couple weeks ago.
On the tree, I keep Manatee beautiful?
I don't know for them. There was City of Bradenton, and they did something about, you know, you can come get a tree or.
Right.
They posted on Facebook. It was related to Arbor Day.
Right.
Maybe.
So Laura will get another assignment. Poor Laura, she'll never take off.
Like, you know, it's not clear, like, can anybody just go get a tree, like, first come, first serve, or Sarasota does the same thing. Market that got rained out, it's the first, they said that in the Facebook post on that one, it was a first come, first serve, and it was who recognized the trees they had. Yeah, there were no requirements. Okay.
You know what I love about this more than, go ahead, sir. Oh, I thought you were going to say.
Oh, thank you.
No, but what I was going to mention, what I like about the Citizens Academy, once we get to know each other, guys, you'll figure it all out just by yourselves. We just need to get out of the way. That's the networking is my favorite. Okay, so recommendations on access to services for those in need but are not able to use or access technology. There's a lot of that. In Manatee County, we do have a services, you dial 311. It goes specifically to people that should be well versed in how to get answers and resources. Do we still have 211? Okay. Another one that is available that has nonprofit information is 211. So these are numbers that are easy to remember. So that would be what I would suggest to someone that cannot access technology. And even if you can, sometimes, you know, if we don't put the right information into our machines, the wrong information comes out. Yes, ma'am.
And Turning Points puts out a booklet every year with the nonprofit information.
That is correct.
Yep.
Okay. What
As
else?
well as your local library.
Oh, that's right.
They're not in our department anymore, but the library has lots of good resources, and the librarians are very helpful. If you go there and talk to them, they definitely can give you and point you any direction. They also have technology there available, but they can, you know, help you kind of access that if you're struggling and you do have to do something online. They're very helpful about that.
And Whole Child for Children's Services.
For under 18.
Okay.
There is a.
Yes.
Okay, so that was my question.
Yep.
And, you know, so I did all those contacts. Somebody that I was trying to help. Honestly, I probably need to take, I was working with a woman, I believe she'll be unhoused by August. She will have burned through the money that she sold her
very damaged home in northeast Bradenton,
Mm.
and she'll probably be unhoused by August, the way she's blowing through this money. But she's a veteran, there's all kinds of stuff. She's got cognitive issues related to substance abuse. So she can call 311, 211, all we want. We could put Jack in the car with her from the VA, and it's still gonna be a problem, okay? But, so one of the reasons I asked, I have a question about, can a family member reach out to the Veteran Services directly? I just keep sending information to her sister.
Mhm.
But, this is not a cooperative person.
Right.
But is probably gonna be up at the Walmart on 64, walking back and forth pretty soon, looking for any assistance.
Mhm.
So, I don't know how to get them, she needs a case manager.
Right.
I don't know how to get into that, and,
Is she under 60?
no,
She's over 60.
she's over 60, she's 63.
And is she willing to take services? Because this is the other.
Oh, I think she's depending on the government to take care of her when she runs out of money. But that doesn't mean she's willing to follow the rules.
That's a little complicated.
It is. I spent 6 months trying to help this woman keep her house.
No, I know.
I'm computer literate, and I went through all kinds of agencies, and then things sort of fell apart quickly at the homeless shelter the VA put her at.
Mhm.
And then her solution was to spend down the money from the sale of her house.
It is difficult. I know. Those situations are very difficult. And at least she has an advocate.
Not anymore.
They burn bridges.
Yeah.
Unfortunately, yes.
That's what happened.
Okay, I have two more here, and I'm not sure if they're talking about my grant program or if they're talking about Julia and Debbie's grants. But one says, where do the grant monies come from? And another one is similar, says, how many grant programs are federally funded? If you do receive federal funding, what was the fund affected by DOGE? My grants are not federally funded. The Neighborhood Enhancement Grant and Neighborhood Action Plan Grant are funded through our general fund. So they're just approved every year. So as long as the Board of County Commissioners approves them, they'll be approved every year. As far as for Julia's, she's federally funded.
Yep. Sorry, I have so many things in my head. Thank you for your question. Yeah, so currently we are not impacted by the DOGE efforts. We have funding until September of next year. The federal Congress is going to start their budget process for fiscal year 26 moving forward, right? And so at that time, we might be impacted. So, but currently, we are okay.
What about your state level stuff, since they're squabbling up there in Tallahassee now?
I mean, our housing program, state funded housing programs, that money comes from the Sadowski Fund, which that money comes from the dock stamps of every purchase in the state of Florida. So we're actually fully funded for the last couple of years. So we've had zero impact. Our funding has not gone down.
For our aging services that is state funded, we have not received, we just received our contracts for this next year. Our fiscal year for state is July 1st, and we did not receive any reductions. So as of right now, we're not affected at the state level funding.
And children's services is a third of a mil. It's on your property tax.
Sure. All right. Does the Manatee County Aging Services cover the city of Bradenton? Yeah, it's Manatee County, so it's all of Manatee County. So it doesn't matter if it's the city of Bradenton, city of Palmetto, it's all of Manatee County that our services cover. Is there a maximum on income for this help? For our in-home services, there is not. The state has a sliding scale copay assessment. So we do ask our clients what their income is. Depending on their level of income, they might pay nothing towards their in-home care up to a percentage of their income. So we ask about the income for that purpose, but it is not it's not required for you to be eligible. There's not a limit. If a person is assessed a copay based on their income that they say will cause a hardship to them, we do have a form where we look at what they're bringing in, what their bills are going out, and there is the possibility their copay could be waived. And I will tell you, the cost of in-home services out of pocket is extremely expensive. So even if you're paying $100 a month, that would get you 2 hours a week of care out of pocket. Okay, this is sort of the same. Is there funding for elderly people? What income level? So if you're talking about the in-home services, we just discussed that. Where does the Department of Elder Affairs get the funds to offer the grants for elderly services? So the Department of Elder Affairs is a state department, and it's just a part of their annual budget process. When the state goes through that, it's one of their line items. Any plans to improve emergency shelter for frail elderly residents? Electricity and a cot are not sufficient for an infirmed person needing hospital beds and medical transportation. So the county has two types of shelters, general population shelter and a special needs shelter. The special needs shelter is for individuals who are reliant on electricity to live, such as oxygen dependent, refrigerated medication, or if there's a memory impairment. The general population is for everyone else. Shelters are not comfort shelters. They are emergency shelters. We always stress, at least to our aging services clients, try to make a plan other than going to a shelter. If you have high medical needs, you should be talking to your doctor and coming up with a plan, whether it's to temporarily go into an assisted living facility, going to the hospital, or something like that. The special needs shelter is not a hospital. It is not a medical facility. It is managed by Department of Health. They do have nurses there, but it's low level assistance medically. You do have to register. So I'll take this moment to say the county has a special needs registry. The special needs registry, you fill out a form and the Department of Health will review it to see if an individual qualifies to go to the special needs shelter during times of evacuation. But at the same time, the special needs registry will register folks who need transportation to either shelter. So we actually, when there's evacuations and shelters are opening, one of our tasks is to call people on the registry who may need transportation to any type of the shelters and coordinate with our Manatee County Transit so that they can get picked up and taken to the shelter, and then of course they'll be brought back home when they're able to.
And they do call. They called my house for my son.
Mm-hmm. Yep. We call. We called lots this last season. Let's see. And we will say, even if you think you don't need it, register. It doesn't hurt because you never know. You just never know. Can the ambulance assistance program reimbursement? No, we do not reimburse if you've already paid. It would be before you pay. And we do have a relationship with public safety where the ambulance bills are generated and administered. So when they know that we are working with someone, we're like, hey, we're working with them to see if we can waive any of their bill. They won't let it go to collections or anything like that. If it goes to collections before someone reaches out to us, we can get it out of collections, but we just don't do a reimbursement. There's actually, this is one program that actually doesn't have a budget because we're waiving. So we're waiving fees, but there's no money attached to it. Okay, so this is when you say public safety, what does that cover? So I was talking to Renise and she had mentioned public safety. So public safety is exactly what it sounds like. It's the safety of the public. There are many programs that we have. Renise's, the funds that she gives out to like the city of Bradenton Police, the sheriff's office, it's all to go towards some sort of equipment or function that is to protect the citizens of Manatee County.
But it's law enforcement.
In law enforcement, but public safety is, and you're going to hear from the Department of Public Safety. So that's why at one point animal welfare was a part of it, to protect the public. The EMS system is through public safety. Code enforcement's through public safety.
ECC, which is the 911 system, beach patrol, and all that, water rescue.
Yeah.
They're independent. They're independent taxing experts, so I don't know. That's why I'll ask.
Who to contact to donate durable medical equipment, including full motorized hospital beds, etc. So, public safety will be here next week, and they have a community health division, and they have a closet. Huh? Oh, you'll be going to public safety, and they have a loan closet or a closet of supplies, and that will be the perfect place for you to donate these items to, because their community health team is out in the community seeing people who have needs, and they then will be able to provide that to them if they can't, access it themselves.
All right, Jack.
All right. Very quickly, we have a program called Manatee Moves. Has anybody heard of it for veterans? All right. Make sure you pass that word to veterans who need transportation and medical appointments, dental appointments, or to come see us. Does Veteran Services cover the city of Bradenton? Yes, we do. Anybody in the county. There for years, we took care of any veteran, but we had about 500 or 600 from other counties coming into Manatee. So we stopped that. If you want a presentation, please call my office. We'd love to come out and do presentations. We're actually hiring an outreach coordinator. The job should be posting soon, and we're hiring somebody to do that full time, because right now our counselors are taking time out of their day to go out and do these. But yes, just give our office a call, and we'd be happy to come out. And as far as helping, if you have somebody that's incapacitated due to memory, we can sign some forms and we can get access to their files and we can let you help them. So that is we do that quite a bit, unfortunately. As far as the Veterans Administration and how we work as a county veterans office, we have, once you come in and see us, we have access to your VA files. So there's no reason ever to call the VA again, because when you call the VA, you're 1 in a million. They're going to look at the canned speech that they have in front of them, and they're going to read it to you. We're going to open up your files and look at your files and see what's going on with your claim. So we can really do anything the VA can do, because we do have access. We're trained and certified, and we have access to their systems. And I will let Renee know. Renee's probably helped a lot of veterans in this county. And I think that was it.
I have one more question.
Yes, ma'am.
Can you guys help get outside records into the VA system?
Yes.
And they'll actually be there?
Yes, we do that every day. You could actually, as long as we have a file on that person, you bring the records into our office, we scan them in, attach them to that file, and we can send them.
Can you get those records from the doctor's office who only will do CDs or scan?
That's an issue, yes. We get a lot of records on CDs, and we cannot put a CD on a county computer. You can go to the library, but then you're going to end up printing it out, and that could be very expensive, yes. Yes, ma'am.
In terms of housing for veterans, like someone that has memory or any memory issues, is there other options the county provides besides nursing homes?
The county. I know that the VA does. The VA has contracted assisted living facilities that they can put the veteran in. They also have state nursing homes. So there's a lot of, for a veteran, there's a lot of choices. And he would still qualify for anything the county had. He or she would qualify for county programs as well. Did that answer that?
Yeah, I was a friend I know the veterans families pretty much abandoned him, and he's in a nursing home, but he's very ambulatory.
I got the perfect woman for it.
Yeah. If you have any veterans that have any problems or family members, we have them call our office. I mean, these things that you're bringing up, we do every day. So, yes, give us a call. Anything else for Veteran Services? Thank you.
We're back on. Okay, now, I'm going to put a probation hat on, so Laura's going to get some assignments. Anyway, how can someone get a copy of your job list for the probation division? We will have to find out. But I will tell you, under our Neighborhood Connections magazine, we have job opportunities that we know about. So.
And if you're looking for county jobs in general, you can visit mymanatee.org/jobs, and that'll take you to the list of all open jobs at Manatee.
And I think doesn't probation have a page that has all of their current?
Under the website?
Right on the website.
Okay, so if you go to My Manatee and look for the probation division, you'll probably get this information. Then I was also going to put a plug in for Career Source Suncoast. They receive federal funding and state funding for workforce, and they help with training, they help with obtaining jobs, on-the-job training. It's a really, really, really good resource. And then I don't know how to, if somebody can clarify what they meant by what county holidays exist. That for probation or
Like today, you guys don't work, those are the county holidays.
Yeah, those are just taken from
Yeah, we got that in that
first thing? So they're taken from
They're the federal holidays.
holidays. It's the same. Okay. And the 1 hour class that is recommended, we will get that information because I don't remember. I think it's yes, that's what I thought it was. The Victim Impact Panel. Okay. So we will find out. And that might be on their webpage too. It is. Okay. So Laura might not have any assignments on us. Okay, and lastly, although I'm bringing up the director, Sarah, I have to read this one. Then Debbie and Julia got for the best presentation. I hate to inform you guys, they're not here next week, but we are. And we don't forget easily. But somebody has made some atonement by saying the Neighborhood Connections magazine is awesome. So you are redeemed. Okay, and then we'll have Sarah. Whose glasses?
I wonder if they're Jen's.
All right, so the one question is, where can I find the flood zone map for Manatee County, not the evacuation zone? You can actually find those both in the same place. If you go to mymanatee.org, they have buttons on the front page, and it's the most frequently asked thing. So flood zone is there, and right under it is your evacuation zone, which it is hurricane season. You need to know that, so if you don't. Also, mymanatee.org/storm. You didn't ask for this, but you should check out that page. It gives you all the up-to-date information on sandbag locations and everything going on with storms, which we are not going to have this year. Since Matt left, as I said, Animal Services is going to follow me around for the rest of my life. I could become president of the United States, and people are still going to ask me about Animal Services in Manatee County. But And don't worry, I'm not going to be the president because that would be a terrible idea. Pet Pantry, can you donate money or send food via Amazon or Chewy? Absolutely. You can send it to any of our locations, although I would probably direct anybody to Bishop because our move-in date is supposed to be December 11th this year. So Palmetto will then close and then go to another organization. And you can donate money, and that would be through our Friends of group, so the Friends of Manatee County Animal Welfare. The next question, are they no-kill shelters? Animal Services is proud to have a save rate of 90% or higher since October of 2017. So that is a considered no-kill. I think our save rate right now is around 95, 96%. So we're pretty proud of that. How many pets are surrendered each year? Well, unfortunately, that number is going up. In 23, it was around 3,500. Last year was 46. We're on track to be over 6,000 this year. Yesterday, we took in 51 animals, where our average used to be about 10. So it is not good. It is bad. We do a lot of sterilization services. It is mandated by Florida statute that any animal adopted is sterilized, so they can't reproduce. But yeah, there's a lot of animals here right now. Well, they want the flood zone, not the evacuation zone. Oh. Well, it's on the front page of the website. How long do you hold animals? So if it is for the stray hold period, a cat is 3 days, a dog is 5 days, and then after that, as long as they're adoptable, they will remain with us until they are adopted. If they are a vicious animal, we do take in dangerous dogs. We do declare animals dangerous, so we do have that portion of our job that's not as fun. But it does keep our community safe, and that's really important. But as long as an animal is adoptable, it will remain, and we are going to try to find it a loving home. Are there any other questions? No?
In the numbers, or is it nationwide or statewide?
For I think the biggest problem is adoptions are on the decline, although ours are continuing to climb. But it is a national issue. I feel like it's just really bad here right now. It's not as bad nationally, but there are people are still breeding, and people have the right to do that. If you do that in Manatee County now, you need a license now, which is something we've implemented. It is free, but it's just our way of making sure the animals are cared for in a proper fashion. So, any other questions? Yes.
I just want to make a comment. Because I think this doesn't fall under your department, but the prison has that sheriff's farm, so that's a kind of a work program. If you haven't been up there to buy inexpensive landscaping plants of different sizes, it's not a terrible drive. It's long. I didn't realize, that's not when I realized in the first week when they showed how big the county was. I've never driven
Out to the port, yeah. The sheriff does a great job. They're amazing. They have wonderful programs, and they just keep adding programs. We're going to have adoptable dogs out at the jail very soon. The kennels are going up, and they're going to work with the dogs and make them more adoptable. And I know that's going to give them even better chance of getting adopted, just because they've been at the jail, and it's a cool story to tell. Like, this was worked in by an inmate, so we're super excited for that. Plus, it helps us with our capacity. Anything else? Well, then I hope he doesn't try to read or need his glasses, because he was driving to Plant City, so that'll be a problem for him. Well, I can get them to him. All right. Well, if that's, I guess. Oh, we're almost there. I'm like, we're right on time. Look at us. And we thought we were running early, but we have a lot of things to say. Oh, what? Oh, it's 12:01. All right. Thank you all so much for learning about Community and Veteran Services, the most amazing department in Manatee County. We appreciate all of you being here and learning. Thank you so much. About today with our community organizations active in disaster and all of our fun roles that we have there. So when you see the Human Services branch, cheer, because you're going to be like, I learned about them last week and they are the best.
All you will get the email, trust me.
Yep.
Thank you all.